Diabetes is on the rise worldwide and is a serious, lifelong disease that can lead to heart disease, stroke, and lasting nerve, eye, and foot problems. Let's talk about diabetes and the difference between the three types of diabetes. So, what exactly is diabetes? Where does it come from? An organ in your body called the pancreas produces insulin, a hormone that controls the levels of your blood sugar. When you have too little insulin in your body, or when insulin doesn't work right in your body, you can have diabetes, the condition where you have abnormally high glucose or sugar levels in your blood. Normally, when you eat food, glucose enters your bloodstream. Glucose is your body's source of fuel. Your pancreas makes insulin to move glucose from your bloodstream into muscle, fat, and liver cells, where your body turns it into energy. People with diabetes have too much blood sugar because their body cannot move glucose into fat, liver, and muscle cells to be changed into and stored for energy. There are three major types of diabetes. Type 1 diabetes happens when the body makes little or no insulin. It usually is diagnosed in children, teens, or young adults. But about 80% of people with diabetes have what's called type 2 diabetes. This disease often occurs in middle adulthood, but young adults, teens, and now even children are being diagnosed with it, linked to high obesity rates. In type 2 diabetes, your fat, liver, and muscle cells don't respond to insulin appropriately. Another type of diabetes is called gestational diabetes. It's when high blood sugar develops during pregnancy in a woman who had not had diabetes beforehand. Gestational diabetes usually goes away after the baby is born, but still pay attention. These women are at a higher risk of type 2 diabetes over the next 5 years without a change in lifestyle. If your doctor suspects you have diabetes, you'll probably have a hemoglobin A1C test. This is an average of your blood sugar levels over 3 months. You have prediabetes if your A1C is 5.7 to 6.4%. Anything at 6.5% or higher indicates you have diabetes. Type 2 diabetes is a wake-up call to focus on diet and exercise to try to control your blood sugar and prevent problems. If you do not control your blood sugar, you could develop eye problems, and have problems with sores and infections in your feet, have high blood pressure and cholesterol problems, and have kidney, heart, and problems with other essential organs. People with type 1 diabetes usually need to take insulin every day, usually injected under the skin using a needle. Some people may be able to use a pump that delivers insulin to their body all the time. People with type 2 diabetes may be able to manage their blood sugar through diet and exercise, and if not, they'll need to take one or more drugs to lower their blood sugar levels. The good news is, people with any type of diabetes who maintain good control of their blood sugar, cholesterol, and blood pressure have a lower risk of kidney disease, eye disease, nervous system problems, heart attack, and stroke, and can live a long and healthy life.